This
with the
meeting is
first
now
slide
being recorded.
with who should be referred to Anchor Center. I know that sometimes there's, some questions and confusion about, whether a child has a visual impairment and what types of eye conditions rise to the level of visual impairment. So attached here, there are the ABCs of vision problems and visual development guidelines. And I have links to those or copies of them that I can email out to you. So you will have copies of those too. And they're just taken directly off the Colorado Department of Ed website under the vision tab. And really, first and foremost, I would say for any child or any provider, service coordinator, parent, if they have any concerns in any way, the first and most important thing to do would be to have that child seen by a pediatric ophthalmologist. And we'll talk about kind of a little bit about why that's so important a little bit later. But that is always the first step, and mostly because you can't. There can be eye conditions that are in the back of the eye that just can't be seen, and such as like retinoblastoma, which was a form of eye cancer. And while it's rare, it's something that obviously we want to catch as soon as possible. So any types of vision problems, again, first thing would be to refer to the pediatric ophthalmologist. I'm going to just go through the ABCs of vision problems and the visual development guidelines pretty quickly. When you actually have the copy in front of you, it's pretty straightforward, just bulleted points and then a checklist. So the ABCs of vision problems, basically it's A is appearance, B behavior, and C complaints. And it's just a short list of things to look for, whether, so for appearance, if the eyes are crossing in or out, or if the children have nystagmus, which is kind of looks like your eyes are dancing, where they kind of jiggle back and forth a little bit. Drooping eyelids, if the pupil sizes are different, or you can see that the pupil maybe isn't round. It's could be like a keyhole shape or have like a little notch that it looks like a notch is taken out of it. So those are the types of things that you would want to be looking for. As far as behavior, it would be like a reduced eye contact, or if they turn away from you and don't face you, if they're not reaching out and grabbing for toys or a bottle or for faces, anything that's presented to them. If they tilt their head to one side or the other when looking, and I know sometimes it's hard to tease that out with kids who have motor delays or CP or any of those types of things. But so really, again, I know kind of trying to tease it out, but as therapists and interventionists, when you're in the home so often, I think it's a lot easier sometimes for them to understand and tease that out and figure out if it is a true visual concern or not. And then there's the C for complaints. So typically with obviously infants and toddlers, they're not complaining too much, but if they have like an extreme sensitivity to light, or they're always rubbing or itching their eyes, or anything like that, those would be kind of concerns that I would recommend having checked out. As far as the visual development guidelines, there is a checklist, and it's pretty straightforward. And I think, just sort of, as with all development, vision is on a developmental continuum as well. And so there are certain things that we want to see children doing visually at certain age levels, and that's all just kind of put here on this checklist. And so it's just things like, again, kind of looking at your face or making eye contact, smiling at others, looking at their hands, reaching out to bat at toys, and, reaching out away from their bodies to pick up something off of the floor, trying to grab for glasses or jewelry. If they drop a toy, are they turning to, find where they dropped it? Are they interested in looking at books? Do they respond to facial expressions? Can they name familiar items? So those types of things. And again, the month and the age range is listed here next to each one of these next to each one of these milestones that we look for. So, and if you have a lot of checks in the no column, again, that would be a great time to refer the child to see the pediatric ophthalmologist. Moving on to the next slide, who is at high risk for visual impairment? Here's a list of children and different types of conditions that we typically see. So with these children, if they have any children who are born prematurely, we often see, especially those micropreemies with ROP or retinopathy of prematurity. In a lot of cases, that can be resolved, but there can be long-lasting damage to the retina. So those children are at a higher risk. Infants with cerebral palsy, any child who has an identified syndrome of any kind, especially the ones that are multisystemic that involve, many different systems of the body, there is an increase for vision loss with those as well. And again, it's pretty self-explanatory going through these things. Obviously, children with seizure disorders, any type of brain injury, they're at a high risk for cortical visual impairment, where basically, your eyes will look fine and your eyes would look okay on an eye exam, but it's all really visual processing, and that actually would also qualify as a visual impairment as well. So again, these things don't necessarily indicate a vision impairment for sure, or positively identify that, but they're just knowing that those children in these categories are at higher risk, and to just pay attention or look a little bit more closely at those little ones to see if it really is in fact vision or something else going on.
So who can make referrals to INCUR Center? Anyone can make a referral to INCUR Center for a child who has visual concerns. We listed, we try to make the list as big as possible: pediatric ophthalmologists, neurologists, pediatricians, other medical professionals, EI professionals, service coordinators, and family members. And we just would like to capture all of the kids who do have vision concerns. So how to make a referral to INCUR Center? And am I able to, okay. So I just want to know if I'm able to control the slides, or Laura, are you doing that? I just want to
No, you'll just have to let us know, Kavanch, if we fall behind. Okay.
Perfect. Okay. So how are the referrals made to INCUR Center? All the referrals can be made to INCUR Center by going to our website. You will see a tab on the top right-hand side called Child Referrals. When you click on it, it will take you to a link. And it's a very simple form. It's a 3-page form. We just try to collect some neurological information, vision diagnosis, any medical conditions, and EI information. If the child is connected to a CCD, then we would like to have that information as well. And the reason why we would like to get all of the referrals online is it just makes the process a lot easier for us, faster and efficient for the people who are making the referral. The turnaround becomes a lot faster. Then I would get an email automatically in my inbox saying that a referral has just been made. Then I would let the service coordinator or whoever has made a referral know right away that a referral, we received a referral, and then the information will be processed. With the referral, we also would like to have a report from ophthalmology or neurology verifying that there is a visual impairment. And we do understand in some cases there is no certain diagnosis for that child, and the ophthalmology report may not name a diagnosis, but we still would like to get the ophthalmology report. Any child who has concerns of visual development are really encouraged to schedule an appointment with the pediatric ophthalmologist prior to begin the referral process. And we do understand in some cases the family may have no means to have a connection with a pediatric ophthalmologist due to insurance or some other reason. So if that is the case, just let us know, let me know, then we can schedule that child with Dr. King, who is the ophthalmologist who would come and donate his time to Anchor Center twice a month at Anchor Center. So that's also an option for all of the families who are having a hard time scheduling an ophthalmology appointment. And so what happens after a referral is sent to Anchor Center? I will let the service coordinator or whoever made the referral know that the referral has been received, and we will contact the family within 5 days. And if the family is, and I can see that information on the referral, if the family is connected to the EI, then I would let the service coordinator know. If the family is not connected to EI, and I would just call the family, give information about early intervention services. And if the family would like to be connected, then I would also make a referral to early intervention. And with the referral, if the ophthalmology report is not included, then I would request the ophthalmology report as well, and also discuss the need of the service coordinator for a one-time functional vision assessment. With the referral process, we just would like to make sure that the family understands that's one of my priorities, what the next steps are. We do understand that it's a very terrifying, scary experience when a parent is told that their child is blind. So we see our role as gatekeepers and letting the family know that what's going to happen and how the functional vision assessment will inform our teachers about the child's vision is going to be totally play-based, and we just would like to let the family know it's going to be a very welcoming environment and the resources are going to be available for the family. Then after all this discussion with the family and the receipt of the eye report, then I would schedule the functional vision assessment with the family, usually within 2 weeks.
Great. So why is an eye exam required? I know this is oftentimes a big question of, why can't a TBI just come in and assign services or decide that a child qualifies before an eye exam is completed. But really that's for a couple different reasons. Kind of like I said before, ophthalmologists are the only, they're the only people who can actually look into the back of the eye and make sure that all the structures are normal and that, or see any problems. So without all of that equipment, the slit lamp and the retinoscopy and the different tools that the ophthalmologist use, we really and truly have no real idea of what's going on with those kiddos and their vision. And then, as I mentioned earlier, also, with retinoblastoma as an example, it takes the ophthalmologist looking in the back of the eye to be able to see those tumors. And, if you had a TBI going in and assigning services to this child before and not having a referral to a pediatric ophthalmologist, you're just wasting really precious time, for that child to be, receiving the proper treatment and those types of things. The other thing is that a lot of times our children, we get referrals for kiddos, and they may have something pretty simple like a strabismus or something, which is just, an eye turn in or out, so where the eyes cross. And those oftentimes can be treated pretty easily. So the eye doctors will do patching, or they may do surgery to straighten out or realign the eye muscles. And so again, in cases like that, that doesn't rise to the level of a visual impairment because it can be treated. And so then, those children wouldn't qualify for services with Anchor Center. So there is some logic and pretty solid reasons behind why we really need the ophthalmologist to be looking at those kiddos and following them. And again, so once those eye conditions are diagnosed, oftentimes they do go along or with other types of delays or medical issues or anything like that. So again, if, for example, syndrome of optic nerve hypoplasia, oftentimes the children who have that syndrome have endocrine issues as well. And so, just by looking at a little kiddo coming in, we wouldn't be able to tell that they had underdeveloped optic nerves and then all of the other things that could potentially be going along with that. And it's really important for us to know that so we can make those referrals to families, to get into the pediatrician and to the endocrinologist and to see the other appropriate specialties so they can make sure that they're really tracking that child and knowing, what's going on and, so hopefully they can either prevent things from happening or, help them along and with any other issues that they might be having. So the next slide is how does the eye exam inform the functional vision assessment? And once we kind of know what the eye condition is, we have oftentimes a pretty general idea of how that vision or how the child's vision, how they're using it, and kind of what the capacity is and what the severity can be. So for a child who has albinism, for instance, we know that they usually have pretty good vision. And then we usually consider them to be low vision learners who may just need, large print or magnification as they start reading later in life. There's typically not a lot of other developmental delays or anything that go along with it, which, again, that's typically, there's the exception to the rule on that. But so just knowing that piece of it kind of, helps guide us into, things that we really need to be looking at. So the other part of that is it lets us know kind of, if a child is wearing an eye patch and also has a visual impairment on top of that, kind of, lets us know they're being followed. What do we need to look for? Do we need to help support the parents in keeping that eye patch on and giving them activities to do or, encouraging them to, be really consistent with wearing the eye patch. And so, again, that kind of gives us an idea of how we can support the families and, giving them strategies for, kind of carrying through those treatment plans at home. And then again, if they have surgery or anything like that, obviously they're getting information from their doctors and ophthalmologists, but we can also give them a lot of information and, kind of support through those types of things. And then the other thing, just one quick last thing on that slide. We have oftentimes, I can't tell you how many times this happens, and I'm sure it does in other cases as well, but the parents will say, we'll receive an eye report and with the diagnosis, and the parents will have no idea that diagnosis has been listed or given to their child. And so oftentimes we're kind of the first people who are telling them what the diagnosis is and giving them really solid information about the effects of that and how that is going to affect their child developmentally and kind of down the road in school and all of that. So it really is helpful for us to have those reports, and then we can just kind of go through step by step. And sometimes they're a little bit difficult to understand, and they're written in code, with all the different letters and numbers and stuff. And so we can really help families with understanding what in the world those things mean, and not just what it means for the physical condition, but what it really means for, functional use and how that child's going to, access their environment. Okay, so pediatric ophthalmologists are obviously the best people to be providing eye exams for children. They have the background, they have the medical background, and can, oftentimes they do surgeries, they can, diagnose a variety of different eye diseases and those types of things. Optometrists are trained to provide eye exams. For the most part, I would say optometrists are really more trained in adults and don't have a lot of pediatric experience. But as far as doing an eye exam and being able to tell if the eye was healthy or something, they would be able to determine that. Again, it's just the level of expertise on that. Being able to detect something pretty small that in a child if they're not really comfortable or familiar with working with children. They can prescribe glasses, but that's pretty much the scope of their practice. And as far as Anchor Center, an optician or a report from an optician would not meet our requirements for an appropriate eye exam. We would want that to be either a pediatric ophthalmologist or a neurologist. And we've made the exception with the neurologist for a couple reasons, because many of our children have cortical visual impairment. So again, the children who have seizure disorders or metabolic disorders or traumatic brain injuries, their eyes look okay, but it's the visual processing. And so over the last several years, even I would say probably 5 years ago, it was really difficult to find a neurologist who would diagnose cortical visual impairment. They would say, oh, that's the ophthalmologist's job to do that. And then the ophthalmologist would say, oh, no, that's not our job. We let the neurologist do that. But we've really had some good conversations with some of our local pediatric ophthalmologists and neurologists, and we've seen a lot more referrals and diagnoses of cortical visual impairment from neurologists than we have in the past, which is wonderful. We like to see that because it just gives us, again, that kind of a head start on some of these kiddos and those types of things. So let's see, we can move on to the next, what constitutes an eye report. And basically it's just kind of, obviously the medical history, some of the, biggest findings and concerns. If there is a documented diagnosis, obviously we will want to know about that. The eye doctors give us information on the anatomy of the eye and the retina or the optic nerves or any of those types of things if they're affected by any type of disease. Refractive error, which would be prescription glasses. I think that's probably one of our number one questions after, can you tell me what my child sees, would be, can we give them glasses to see better and fix it? And unfortunately, in the majority of the cases, glasses aren't appropriate and wouldn't help improve the vision. But in the cases that do, we do like to know what the glasses prescription is, if it's for nearsightedness, if it's for farsightedness, and those types of things. And then kind of the risk for visual impairment. Sometimes conditions, again, they're kind of on that continuum. Sometimes they can have something mild, or there could be a pretty severe degeneration of the optic nerve or something like that. So we like to know that. And then really just sort of like there's usually a summary at the bottom of just kind of everything that the doctor has seen, if there's any diagnoses given and what they are, and then the recommendations for follow-up care. As far as the functional vision assessment, really what we're doing, what our most important job is to figure out how that baby, how that child uses his or her vision, and uses it to gain information to access the environment. So we're really looking, even for children who have low vision or who may have a pretty significant visual impairment, we are trying to determine, are they using any vision at all? And if so, are there ways that we can, strategies or anything that we can do to adapt the environment or to encourage them or motivate them to use their vision? Oftentimes, again, with, different strategies and techniques that we use, we can see that, children using their vision a little bit better and learning how they can get information visually. And so a lot of, again, kind of, just seeing how they interact with their environment and, how they're using their vision. And if they're not using their vision, we want to know what sensory channels they are using. So are they using touch? Are they using their auditory system? Do they need to move? What types of things, is that baby using or doing to get information about the environment? And how can we set the environment up to make sure that that baby has access to the information that he's going to need? So after, we kind of look at that through the routine, through their daily routine. How do they tell you that they're hungry, or how do they ask for more food, or how do they know that they're, getting ready to take a bath? So again, kind of different things like that, and how it affects different parts of their play and their routine, and communication and movement and social skills, cognitive development. We're looking at all of those types of things. We're looking at how, different visual behaviors. Do they squint their eyes when it's really bright outside? Do they rub their eyes? Do they turn away when they're too overwhelmed and can't look at something anymore? Do they get really tired after they've looked at something for a couple minutes or 10 minutes or 20 minutes? What's the difference there? And then again, I've talked about this a little bit, identifying alternative ways to support the child's access. So what are things that we can do in the environment? Do they need, Braille books? Do they need tactile books instead of print books? How are we going to, introduce or kind of set the foundation for, the emergent and pre-literacy activities that all babies are seeing print. If you can see, they're exposed to so much print in the environment. So looking at ways to, sort of embed that just into, everyday activities and routines that, so it's just kind of there. Tactile discrimination, playing with a lot of different toys and textures and, just getting their little hands and bodies on things as much as possible. Again, with that sensory stimulation, how much can they take in? Is it too much if we're talking and asking them to look at the same time? Can they just use one sensory channel at a time, or can we start adding 2 or 3 or more in? So, and then, I think one of the common myth is that if people who are blind have their other senses are just automatically heightened, and that's actually not true. Those things have to be taught in a pretty planned and thoughtful manner. So, really encouraging children to, use their sense of touch and use the sounds and cues in the environment. And so those are skills that we really start trying to work on and lay the foundation for as early as possible. So again, kind of some things that we're looking for in assessments are, is that baby using a purposeful reach? And it doesn't necessarily have to be a visually directed reach, but purposeful. So is he, motivated? Is he, does he have the self-initiation to reach out for a toy away from his body? If he is exploring with toys, how is he playing with them? Is it, kind of holding with one hand? Are they banging them together? Are they mouthing them? How are they manipulating them? Are they doing, cause and effect toys? Are they starting to do 2 or 3 step toys? How are they playing? Kind of, again, visually locating a parent or caregiver. How far away does that parent have to be before the child knows that they're in the room? Sometimes without talking. So if a parent walks in at 10 feet away and that baby can't see them, we want to know how close that parent has to be before the baby can tell that they're there. again, with the lighting, if it's too bright, if they're photosensitive or light sensitive, that's going to affect how they play or how they interact with their environment. Their learning style, are they visual learners? Are they auditory learners? And what's their strength, and how can we present things, to that strength to encourage them to keep learning and developing. Social interest, are they, do they turn to their name? Do they turn to find their mom or their dad or a family member when they're speaking? Are they aware of their environment and other people in it and other sounds? And then just overall development. We know that 90% of what children learn between 0 and 3 is through vision. So if you impair that or take that away, that has a huge effect on every area of development. And so we're really looking to see, again, kind of where that child is developmentally and how vision is affecting it, and how we can, kind of make up for that a little bit or adapt the environment to help move them along. And then obviously, we need to know if they have any other medical conditions or hearing loss or anything like that. So the role of the TDI, I think, again, kind of we're educators, we're not therapists. A lot of times parents will say, we'll come in and we'll talk to them and give them suggestions, and they'll say, but what are you going to do? So I've started just, explaining to parents from the beginning, I'm not like the PT or the OT who comes in and they're, hands-on with that baby all the time, helping them, move and do things. And we really, sometimes we do direct teaching. Sometimes we really are, kind of modeling for parents how to do something, or, like hand under hand, for example. So we are working with the babies. But a lot of it really is, just talking with the parents and, again, modeling for them or kind of coaching them through and helping them, work with the babies. And so they feel comfortable and they're able to, play with their kids and make the adaptations when we're not around. So obviously we also do a lot of assessments. Again, we do a lot of functional vision assessments at Anchor. We also do them in the home, and then we also go to Children's Hospital, and we will do consults and assessments for children and who are seen there who are inpatient. Who qualifies for vision services? So during that initial functional vision assessment, as a TDI, for the most part, we pretty much know pretty quickly if that child is going to qualify or not. And again, it's kind of based on the Colorado Department of Education, their qualifications for vision services. And those are based on the ECEA rules, which is the Exceptional Children's Education Act. And that really, it kind of gives a pretty black and white qualifying guidelines. So you have to have, legal blindness would be 2200. If perfect vision is 20/20, legal blindness is 2200. But then you have the low vision category, which is 20/70 and above. So if any child has vision that's 20/70, they would qualify for services just based on that alone. And there are other things that go into that, obviously. If they have a dual sensory loss, combined hearing and vision loss, if they have cortical visual impairment. The school district really requires them, in addition to having those types of, a medical diagnoses as far as vision loss, the school districts also require that they require specialized instruction from a TDI, and that does get a little bit tricky. As far as, school-age kids and those types of things, especially for the low vision kids who do pretty well in, preschool when everything's large print and bright colors, they might not qualify for services, which is, again, kind of a tricky spot to be in with that transition. But what we found, especially, working with the little guys, is that, it's such a, foundational time of their lives with, as much growing and developing as they're doing those first few years. And so while we use the guidelines set forth by the Department of Ed, we also, we can be much broader about those. So if we have a child who has pretty good vision in one eye but no vision in the other, they would not qualify for services in the school district, but we would absolutely want to see those kiddos, and they might not need a lot of, real regular consistent intervention, but that might be somebody who we really like to check in with just to make sure that they're, using both sides of their bodies the same way. And then as they're getting older, kind of teaching some strategies for, turning your head to make sure that you're looking on, you can see you're looking on both sides of your body and those types of things. So that would just be an example of somebody that we would see at Anchor Center who may not necessarily fit the definition for visual impairment by the school district standards.
So what happens after the functional? Functional vision assessment is the only way for the TVI to determine the eligibility for vision services through Anchor Center. If the functional vision assessment determines that the child would benefit receiving services from us, then I would meet with the families and give them the options of the programming. The parents may choose to attend to the center-based programming for infants and toddlers on Mondays and Wednesdays. And infants are from noon till 1:30, and the toddlers are from 9:30 to 11:30. And the other option is also consultative TVI services with the other providers in the home. When the families come to the program, then we also, our goal would be also help them to connect with other parents. As well, we do a lot of parents programming. Our staff, we have TVIs, we do music therapy every 2 weeks, we have OT, PT, speech therapists. But we also emphasize to the parents that the services that they receive here at Anchor Center, if they choose to come to the center-based programming, they would never ever replace the group, the individual therapy that they would receive in the home through EI. And in some cases, there may be confusion within the parents, oh, I'm getting already PT from Anchor, so I should not continue getting PT at home. So I think that's the collaboration with the service coordinators that we do try to explain to the parents that we only provide vision services and they would never replace their one-on-one service that they receive through EI. So once the eligibility is determined by the functional vision assessment, then I would, or the TVI would contact the service coordinator. A copy of the functional vision assessment is sent to the service coordinator to let her know these are the needs for this child so that the vision goals can be added to the IFSP.
Do you want to try unmuting people, Lenita, or do you want to just go with the ones in the chat? Okay. All right, so the first question that we got in the chat was, could the functional vision assessment be put on the IFSP just to save time for a child that we have vision concerns about? And I did respond to that because the first step in the process should be the ophthalmology exam. So if a child has not had an ophthalmology exam, that would be what you would put on the IFSP plan. And I originally said it could be put under other services, but when I looked at my handy-dandy copy of the state plan, it could also be under vision services. And remember that Kavanch talked early in the call about the fact that they do have availability from Dr. King to provide that service through Anchor Center if the family does not have the resources to meet that need. The next question we have is, if an ophthalmology exam has already taken place at the time the IFSP is being developed or reviewed, can the functional vision assessment be put on the IFSP at that time? So I'm going to turn this over to you guys, Paula and Kavanch, to say, so in this situation, a child comes in, they have had an ophthalmology exam, Would it be appropriate to indicate the need for a functional vision assessment on the IFSP, or would you guys need to see the exam first?
We would like to see the exam first.
Yeah.
Okay.
And just an example of that, we recently had a referral, and there was nothing on the exam that would indicate any type of visual impairment. And so we were like, okay, well, not that we wouldn't want to see this child if obviously he did have a visual impairment, but there were some questions about why he would be referred. And so we called the service coordinator and said, what's going on with this little one? Can you give us some information about why the referral was made? And then, after discussing, some of the therapist concerns and those types of things, we decided, of course we wanted to see that child, but sometimes in those same situations, they'll call and say, that, gosh, I can't think of an example right off the top of my head, but it'll be something, that really we feel doesn't really meet the definition, or, something that we wouldn't typically think of as needing, that child needing to have a full assessment. So we might, give some suggestions, say, hey, try this. And if you still have concerns, call us back at that point, and then we can talk about doing an assessment. So,
okay.
So if we could, again, at least see the eye exam before it's put on the IFSP, I think that would be the best.
Okay. So
we also have, can I point one thing? We also have a list of all of the ophthalmologists that we can share with all of the providers if they would like to share that with their families with different regions. So that might be also a helpful resource for the families to go and see and make an appointment too. Thank you.
Okay, we'll post that as well in the TA call materials. The next question we have from Jean, and I see you responded, Paula, is that are there TVIs available on the western slope? So do you want to talk about that a little bit, Paula?
So, yes, I will. Unfortunately, there are not TVIs who are available to do in-home visits, and that's just simply resources. It's really difficult to find teachers with the visually impaired, and even more difficult to find teachers who want to or are trained in the area of birth to 3 or birth to 5. And so we, over the years, have set up some, like, obviously, connections and relationships with some different areas. Like Grand Junction and Durango, and we haven't been to Telluride in a while, but again, throughout the whole state, Anchor typically sees the northwest region, like kind of the 75% of the state, and then Colorado School for the Deaf and Blind, they see kind of the southeast region, and they provide services down there. So while we don't have the resources to be able to provide in-home visits, we do, again, kind of have those outreach trips, and we call them kind of vision clinics, and it's just, we set up as many appointments as we can, and, families come in and we'll spend an hour or an hour and a half with them and, just try to give them as much information as we possibly can. Most times they will bring their therapist with them, so we're giving information to the therapist, and then we're obviously available for them to call and ask questions. And a lot of times those families, when they're coming over for visits to Children's Hospital or something, will come into Anchor. So I have a family who's coming in next week, and I'm going to meet with them because, they live in Grand Junction and don't get, the weekly or monthly services. So.
Okay. Thank you very much. I'm just sending out a message that we would really like any additional questions to be put into the chat just because of our difficulties with unmuting. And I want to take a moment to thank Paula and Kavanch for taking time out of their busy day to present with us. And then I added another slide here that I wanted to review just because this reviews some of the information that was sent out in the email that all of you should have received a couple weeks ago. So just important information as we move forward. It's exciting for EI and Anchor Center. We're working really closely together right now to get our process down for collaboration and some shared guidelines and shared training opportunities, and this is the first one that we've put into place, so it's pretty exciting. So I just want to remind you of some of the information that went out that's important to remember about your collaboration with Anchor Center right now. Anchor Center providers are really moving towards a real true consultative role within EI, and they're looking at providing consults through co-visits with the primary provider of the child, virtual or phone conferencing visits, and this was in the email. The TVIs are going to work really closely with the primary provider of the child to inform those strategies, which Paula talked about earlier. And then there's some things that we need to think about right now because, as Paula mentioned, we have a current shortage of TVIs. So the first one, encourage everyone to become a TVI. The second one, children currently receiving home-based vision services from Anchor may need their frequencies adjusted. And we've talked about how that process is going to work. Anchor Center is going to contact each family to discuss what will work best. I think that they've made great progress in getting to most of the families already. Then they're going to contact the service coordinator to discuss any changes that might need to be made to the IFSP for team discussion. If an IFSP review is upcoming, the service coordinator should contact the Anchor Center to let them know so that they can prioritize making contact with that family. And if for some reason an IFSP review must be conducted without an Anchor Center provider present, vision services should not be determined until a TVI can participate in that discussion. And that's why we're going to be looking at some alternate ways that might happen, because we know that it's problematic when IFSPs need to be reviewed right after they've been written. Do you have anything to add, Paula or Kavanch?
No, that all sounds great.
Okay.
I would just add, when you said everybody should become a TVI, there is a program in Greeley that's an online program. So if anybody's interested, I'm just putting it out there.
Okay. We have a couple more questions that have come in. Who is the Anchor contact to set up the rural outreach trips? We're ready for the team to return to the Southwest. That was from Trish down in Cortez.
Okay. I would say probably Savannah, who's our director of operations. She would be the person to contact, and I think you have her email, Laura.
Yes, we do. We can connect with that, Trish.
Okay.
And then Monica said she didn't get the email, so we'll resend it. We certainly will. And then Paula and Kavanch, could you put your contact information into the chat?
Sure.
All right. That's what we're going to do, and then we're going to move on to some EI updates.
All right. Thank you so much for letting us be a part of this. We're really appreciate all of your time spending with us, Laura, and working on this and kind of building this partnership. We really appreciate it, and we're looking forward to moving in the right direction.
As are we. Thank you so much.
Thank you. Thank you. I'm just typing my contact information. Thank you so much for everything. Yeah.
Okay. All right, we're going to be moving on to the EI updates, and we're turning it over to Ashley.
All right. Hey, everybody. This is Ashley here. So just a couple quick updates. This last week I did have, we had our monthly data system webinar, and an exciting announcement was that we have our support contract in place. So yay, very, very exciting. So we're going to quickly move forward with that. I have posted on the EI data system website within the chatter with the Unicorn troubleshooting user group, and then also is just free floating out there if anybody follows me in the data system with some fixes for the future enhancement. So if anybody would like to add to it or take a look at that document, it is on the EI data system or it's in the data system, so everybody can go ahead and take a look at that. And any updates, go ahead and email them directly to me. I am also going to be sending out a list of all of the current active users of the data system to individual CCBs. So there's quite a few of them out there that are active, or users that are active that have not logged into the system yet. So I'll just have everybody take a look at that document, and then you can just send it back to me if people on there need to be deactivated. So if you need to add new people, you can always email that to me, but also it's just important to email me when users no longer need access to the data system. And then a reminder about the Family Outcomes Survey, so important dates. We will be sending out the Family Outcomes Survey on April 15th. So please, please, please make sure that all of the contact information is up to date. We need current addresses and phone numbers, especially phone numbers for families where the primary language is Spanish. We will be working with an outside agency that will be contacting those families via phone. So please go in and take a look at the survey, or at the survey guide, which is on the EI Colorado website. And you can just search for it up top, and it'll give you a snapshot of all of the important dates to remind, or to be aware of. And then just make sure everything is updated in the EI data system by March 15th. And those are my updates.
Thank you, Ashley. This is Lenita, and I just wanted to send out a call for input for the statewide meeting. We're in the process of getting the agenda together. So if you have concerns, issues, ideas that you want discussed at the statewide meeting, please send them to me no later than the end of March so that we can consider them for the meeting. And Tracy wanted me to share with you that there are some CCBs that have registered participants to be determined. Maybe you have some staff that you're not sure is going to be able to attend, and that is fine. We have it as a placeholder. But if you could get names and contact information to her by April 11th, then she can go ahead and make sure that they are properly accommodated. I'm going to turn it over to Laura.
Okay, thanks, Lenita. All right, so we have a couple updates about early intervention training, and you'll see that we have the under construction here because we are really moving forward with thinking about how we can best serve your training and personnel development needs at a local level. So we're looking at options for more online learning opportunities, but first we're going to ask you what you need. So be looking for us to reach out to you to say, you know, what type of training would work the best for you to implement at the local level? What do you feel like you're getting too much training about? What are your training needs? So that's going to be the first step in moving forward in a new and better method of accessing and supporting you in accessing professional development activities and needs. So be looking for more information to come out. All right, so here is a really important reminder. When new service coordinators are hired, they are required to complete the online service coordination orientation modules within 1 month of hire, and that's noted within the state plan. Now, WAELA has been spending lots and lots of time sending reminders about completion deadlines. And, you know, those are all those emails with the red in them, because, you know, they're scary. But she just doesn't have the time to ride herd on people right now. So she is not going to be sending reminders about this completion deadline for the online anymore. Remember that you as service coordination leads or administrators can actually go on to the online modules and monitor the participation and completion of the service coordinators you have moving through those, just like WAELA does.
And so we're going to have to really be careful about getting those completed. People are not going to be able to participate in the face-to-face portion without completion of the online portion. So please plan to have that done early. Also, some of the assignments require coordination at the local level, so it's really important not to wait until the last minute. If you wait until the week before the face-to-face portion to complete the online, it's not going to be able to be done well or thoroughly. And if you have questions about how you as a supervisor can monitor the progress of your staff, please just drop Wayla a line either through email or through phone, and she'll be happy to walk you through how you can do that. Okay. Okay, here's another very important thing that we have found out. Many of you know, and many of you do not know, that we are not giving out certificates of completion directly after the training anymore. They're tied to the completion of the online evaluation survey. So for your personnel, after a training is completed, they get a link to complete the online evaluation. When the evaluation is completed, Tracy sends out the certificate of completion. Now, the survey is anonymous. We get a record of who has completed the survey, but we have no way of knowing which name is tied to which individual survey, so people don't need to worry about that. But if you don't complete the evaluation, you won't receive a certificate, even if you have completed the training in its entirety. And as this certificate is your proof that you've completed the required trainings to meet personnel qualifications, that's a real problem. Certificates should be uploaded into the EI provider database so that both we at the state and the supervisor can verify that those required trainings have been completed. So this is super important. We are having people that aren't completing the evaluation and not getting their certificates even though they have completed the training. So it looks like they're not in compliance with personnel qualifications when really they are. If for some reason they don't receive the evaluation link or they lose the evaluation link, they just need to give Tracy a call or email and she'll resend it to them. Okay, so that's just really important and a new process for receiving your certificates of participation. Okay. All right, everybody, that is it. Thank you very much. I have one quick question from Jody. Should we wait until the service coordinators complete the training before entering them into the database? You should set up their record in the EI provider database as soon as they're hired, and then you enter the trainings into the record as soon as the training is completed. All right, thank you very much for spending an hour with us today. We're 2 minutes over, so we're going to let you go. And as always, if you have any subsequent questions, concerns, or comments, just email them to us, and we will post the additional information you asked for on the website, and I will resend the email as well. Thanks, everyone.